Oh, hi, Dr. Wallach. Thank you so much for taking my call.
You bet. What's up?
I'm a long-time listener.
Okay.
I have rheumatoid arthritis.
Okay.
And I know I've listened to your program, and you had said it's not an autoimmune disease.
That's correct.
It's an infection caused by a bug called mycoplasma.
Myco, M-Y-C-O-P-L-A-S-M-A, mycoplasma. It's primarily a respiratory bug, and when it flows over into the bloodstream, circulates around, it likes to set up housekeeping in the joints and tendon sheaths and that kind of stuff. And it's actually a easily killable bug.
After all my research, I would say that infection is a major component of rheumatoid arthritis.
Hello, this is Dr. Mercola, and today I'd like to talk to you about arthritis. What I want to go review in this video is really a treatment protocol and a plan to treat rheumatoid arthritis, which is by far the more serious condition. I first became interested in the alternative views of treating rheumatoid arthritis when I saw a 2020 segment in 1989 that interviewed Dr. Thomas McPherson Brown, who at that time was really close to the end of his life, and I hadn't realized it, but he had been treating for 5 decades or so patients with rheumatoid arthritis and rheumatoid-like conditions. And Dr. Brown was a board-certified rheumatologist. He was actually a graduate of Johns Hopkins University, and really was a pioneer. Now, his theory was that rheumatoid arthritis was actually an infectious disease caused by a mycoplasma, or an L form of bacteria. So he essentially used antibiotics to treat patients. And he had, over his years, treated over 10,000 patients, and most of them have gotten tremendously improved.
In 1939, Dr. Brown discovered what he believed to be a link between rheumatoid arthritis and disease-inducing agents known as mycoplasma.
It's due to, apparently, a bacterial toxin to which the body reacts adversely. And evidently, you have to go for that and get it out of the system, or reduce it at any rate, before the body can return to a more normal pattern.
Hi, I'm Dr. Kurt Wohler. Let's talk about a few complementary therapies for rheumatoid arthritis, which I think you should know about. One, in this video, we'll talk about specifically is the use of a medication called tetracycline. And more currently is another medication in that family of antibiotics called minocycline. Now, there's an organization called RoadBack. If you go to roadback.org, roadback.org, that's a website that's dedicated to complementary information, complementary medical information with respects to rheumatoid arthritis and other autoimmune connective tissue type disorders.